This interactive program presents a broad overview regarding third molars, also known as wisdom teeth. An oral and maxillofacial surgeon is a specialist trained to evaluate and treat problems related to third molar development. Since it's important that you're evaluated on an individual basis, we will only address general information about third molars. Your oral surgeon will be able to address your specific treatment needs. Wisdom teeth, generally referred to as third molars, are usually the last teeth to develop and are located in the back part of your mouth. They usually complete development between the ages of 15 and 20, a time traditionally associated with the onset of maturity and the attainment of wisdom. Since the wisdom teeth are the last to develop, they may not have enough room to adequately erupt into the mouth to become fully functional and cleansable teeth. This lack of room or space can result in a number of harmful effects on your overall dental health. When this occurs, they are said to be impacted, indicating their inability to erupt into an alignment, which will allow them to be able to function in the chewing process. A special X-ray of your mouth and jaws will be taken to determine your wisdom teeth are impacted. There are several types of impactions. Soft tissue impactions. There's not enough room to allow the gum tissue to retract for adequate cleaning of the wisdom tooth. Partial bony impactions. There is enough space to allow the wisdom tooth to partially erupt. It cannot function in the chewing process and creates cleaning problems, among others. Complete bony impactions. There is no space for the tooth to erupt. It remains totally below the jawbone, or, if partially visible, requires complex removal techniques. If you do not have enough room in your mouth for your third molars to erupt and they're impacted, several detrimental results can occur. Unless you have an active problem at the time of your consultation, the reason for removal is primarily preventative to avoid long-term problems. Infection. Without enough room for total eruption, the gum tissue around the wisdom tooth can become irritated and infected, resulting in recurrent pain, swelling, and problems with chewing and swallowing. Damage. If there is inadequate room to clean around the wisdom tooth, the tooth directly in front, the second molar, can be adversely affected, resulting in gum disease, bone loss, or cavities, more appropriately known as dental caries or decay. Disease. Non-infectious diseases can also arise in association with an impact in wisdom tooth. Cysts are fluid-filled balloons inside the jawbone, which are associated with impacted wisdom teeth and slowly expand, destroying adjacent jawbone and occasionally teeth. They can be very difficult to treat if your wisdom teeth are not removed in your teenage years. Although rare, tumors can be associated with the delayed removal of wisdom teeth. Crowding. Although controversial, some feel that impacted wisdom teeth directly contribute to the crowding of your teeth, which is usually most noticeable in the lower front teeth. It is commonly seen after a patient has had braces. There are most likely a number of factors that cause teeth to crowd. Impacted wisdom teeth may play a contributory role. If they are removed for the other reasons mentioned, you will know they did not cause any crowding you see as you grow older. If it is recognized that you do not have enough room in your mouth for your third molars to erupt, it is usually advisable to have them removed at your earliest convenience. In some patients, this can be as early as 11 or 12, whereas in others, it may not be until 17 or 18 years of age. The timing is largely dependent on your root development. Teeth with shorter, less developed roots are generally easier to remove. You will heal faster and with more predictable final healing and have fewer complications than an older patient. If you do not have your impacted wisdom teeth removed in your teenage years or early in your 20s, these problems can arise later in life. If it is necessary to remove impacted wisdom teeth in your 30s or 40s or beyond, it is usually more difficult for you as the patient. The post-operative course can be prolonged, and there's a higher complication rate. Treating these complications is more difficult and less predictable than with a younger patient. If you're over 30, it may be advisable to wait until or unless a localized problem, such as cyst formation or localized gum disease and bone loss, develops, and then treat the affected area only. This is because the predictability of healing decreases with age, and the likelihood of infection and delayed healing increases. Once it has been determined that you may benefit from third molar removal, you can usually schedule your appointment at a time that is convenient for you. You'll be provided with preoperative instructions, which give you specific instructions to prepare you for your procedure. These instructions can also be found on our website. You should generally expect to be in the office for an hour to an hour and a half, unless told otherwise. Your anesthesia options are usually discussed at the consultation appointment. In cases where X-ray films reveal that the impacted teeth would be uncomplicated to remove, or in patients whose anxiety level is low, we may recommend a local anesthetic. Local anesthetics numb the general area of the surgical site. The usual side effect is a few hours of numbness following surgery. For more serious impactions, one may consider a light sedation to relax the patient and allow minimal awareness during the procedure. Side effects of light sedation and general anesthesia can include extended drowsiness, nausea, disorientation, and vomiting. In a small number of cases, allergic reactions to the medications and irritation of the vein where the IV has been placed can occur. This is called phlebitis. When sedation or anesthesia is used, do not eat or drink prior to surgery. Now, this helps to prevent nausea and vomiting during the procedure if light sedation or general anesthesia is to be used. Ask your surgeon for a specific period of time that you must not eat or drink. It's also important that you be accompanied to the surgery and driven home by a responsible adult. In addition, you must not operate a vehicle or machinery for 24 hours following surgery. Regardless of your choice of anesthetics, it is usually advisable to plan to spend the rest of the day at home, with a responsible adult available to help you should the need arise. You will be given appropriate medications to make your postoperative course as comfortable as possible. During the typical removal of wisdom teeth, the oral surgeon exposes the third molar by making an incision in the gum overlying the tooth. A small amount of the thin jawbone that covers the impacted tooth may need to be removed to complete the exposure. When the tooth is clearly exposed, we remove it, sometimes in 2 or more pieces. Once removed, we rinse and examine the area and usually place 1 or more stitches. After surgery, patients are allowed to rest until we feel they're ready to be released. Specific postoperative instructions can be found on this website or in our office. A follow-up appointment will be scheduled a few days after surgery. If you're given antibiotics and you take birth control pills, you should be aware that the birth control pill might become ineffective and take appropriate precautions. Each individual's reaction to surgery varies, and the sensation of pain can range from mild discomfort to severe pain. You can expect approximately 2 to 4 days of discomfort before noting improvement. A variable amount of swelling can also be expected following surgery. The swelling usually peaks on the 2nd to 3rd day. You can limit the amount of swelling you'll have by using ice for the entire first day. The more ice you have on the first day, the less swelling you'll have on the 2nd day. Bleeding, usually for just a few hours, may also occur. On the 3rd day, you may notice that your jaw muscles are stiff and it's difficult to open your jaw as wide as you used to. This will resolve with the help of moist heat. After the 1st day, you can apply moist heat to your face on the 2nd and 3rd day. This will help your muscles to relax more. You may also experience chafing around the corners of your lips, facial bruising, and a small amount of oozing from the extraction sites. Most of the time, you'll want to maintain a low profile for a few days. We ask that you follow your post-operative instructions closely, as they'll make you most comfortable during the first few days following your procedure. Please allow the time to let your body begin healing before resuming an active social, academic, or athletic schedule. Most patients feel like they're over the hump in 3 to 5 days. As with any medical procedure, there can be complications or an unanticipated result that you should be aware of, including damage to nearby fillings or to adjacent teeth. There is a nerve which supplies feeling to the lower lip, chin, and tongue, which is frequently very close to the roots of the lower wisdom teeth. Having these teeth out between the ages of 12 and 18 usually provides shorter roots so that the nerve is not so close to the roots of these teeth. Occasionally, when the teeth are removed, especially in older patients, the roots have grown longer and become closer to the nerve itself. This nerve can become irritated in the process of removing the tooth. When local anesthesia wears off, you may experience tingling, numbness, or complete lack of sensation in the lower lip, chin, gum, teeth, or sometimes tongue. Should this occur, it is usually temporary and will resolve gradually over a period of weeks or months. You should be aware that these changes can be permanent and/or painful. The upper wisdom teeth are situated close to your sinuses, and their removal can result in a communication between your mouth and the sinus. Once again, if the teeth are removed at an early age, the root formation is minimal and this complication is very unlikely to occur. Should this occur, it will usually close spontaneously. We will give you special instructions to follow if this is apparent at the time of surgery. We prefer that you don't blow your nose for 2 or 3 days following surgery. And if you have to sneeze, you should sneeze with an open mouth into a tissue. You should not create any pressure in the sinus area, which may dislodge the healing blood clot. If you sense a communication occurring after the surgery, please contact us. Occasionally, an additional procedure may be necessary to close the communication. Dry sockets arise due to premature loss of a blood clot in the empty tooth socket. This seems to occur with greater frequency in people who smoke or are taking birth control pills. While both jaws can be affected, they usually occur in the lower jaw on the 3rd to 5th day. They cause a deep, dull, continuous aching on the affected sides. Patients may first notice the pain starting in the ear, radiating down towards the chin. It frequently begins in the middle of the night, and the pain medication may not help. Treatment involves changing medications or placing the medicated dressing in the empty tooth socket. The area is often slow to heal and usually requires a number of postoperative visits. Occasionally, postoperative infections occur. In any surgery, bacteria are always present and may cause infection. This usually requires an office visit and examination, and many times just placing you on an antibiotic for 1 week will take care of the infection. It will occasionally require drainage of the infected area, which may have accumulated near the surgical site. Even more rarely, patients may need to be admitted to the hospital for intravenous antibiotics and further surgical drainage. Some patients have jaws that are small or thin. During surgery, it is possible that a fracture may occur or that the roots of adjacent teeth could be damaged. This can happen during or after surgery, and care should be given to avoid hard foods during the healing period. If this information, combined with information you receive at your consultation appointment, does not answer all of your questions, please call the office to speak to one of our patient care coordinators.